Health services researchers probably have a great span. They also call them clinical epidemiologists, but we're generally large data set researchers. So looking at the power of data to tell you what's happening. So I'm not a clinical trial. I've done intervention things, but my first love was to go to the medical record and ask the medical record questions about what might be associated with what. So for my doctoral dissertation, I knew a huge quality of life aspect in transplant, so I can't quite give up transplant, was that fact that they were readmitted so often. And what's the point if you are so sick that you just have to keep coming back to the hospital? What if we knew what was associated with readmission? Could we then early identify those people and maybe implement a program to prevent readmission? So that was my dissertation, looking at a lot of risk factors and looking at 30-day readmission. One really great young researcher, he identified that testicular cancer there was a little blip, and it looked like it was an increased prevalence in the military. And what could we do about teaching soldiers to do testicular self-exams? And so I said, well, let's write a study, but let's not just ask who does it. Let's do an intervention. We decided to put a grant in to make a film to educate soldiers about and see if the film worked. And we ended up getting an instructor from West Point who, because he early identified that he had a lump, was able to maintain, save one testicle and early treatment. And he agreed to be the star of the movie. And the whole little film was about, and he was a helicopter pilot, and he talked about pre-flight checklists. And, he began in the hangar at West Point with his helicopter. It couldn't be more perfect. And it certainly was macho, and it was, and it turned out that, the subjects who had exposure to the film knew more about testicular cancer, and they said they practiced at TSE more often.